What does sulfur have to do with the health of your gut microbiome? They might not seem very closely related. Sulfur is a mineral. It's one of the essential minerals that we need for our body to function, and we can't make it, so we have to take it in our diet. And you may think that there's no correlation, but I find there's a strong correlation between sulfur and the health of the microbiome, and that's something that I've based my practice off for the last 25 years or so. The microbiome health, if it's not in balance, oftentimes you're going to experience symptoms like gas and bloating, like abdominal pain, alterations in your bowel habits, reflux. So there's a lot of things that can happen when you don't have the right balance of species in there. Now, very many times people come to me and they're wondering why they're not getting better, because they're eating a lot of prebiotics. But the problem is that prebiotics can become food for an imbalanced microbiome, and then you're producing a lot more gas and a lot more abdominal pain because of it. So what you want to do when you're experiencing problems with digestion is you want to actually process your diet more. You want to choose foods that are softer, cooked foods, not raw foods. Lots of soft foods like rice and cooked vegetables and soft breads if you can tolerate wheat. You really want to make it easy for your digestive process. So once you get better, you can add in those more nutrient-dense, high-fiber foods, but not when you're trying to get better, especially from something like gasiness, because as soon as those bacteria grab onto those difficult to digest foods, they're going to eat it and they're going to make even more gas, and you're going to be more uncomfortable. So that's where I start with all my patients, is by removing what I consider the inflammatory foods, if we need to, and then by putting my patients on a soft food diet so it's easier for their digestive system to take some time and repair. So what we want to do first is strengthen and heal the gut using that soft food diet, and then replace the key missing ingredient to the microbiome health, which is sulfur. Sulfur deficiency can be driving the overgrowth of harmful bacteria, which is what causes this imbalance. So if you can improve your sulfur levels with the GI Janelle 1 powder, we'll have a link for you. This could be the missing link that you're seeking as you go from practitioner to practitioner and take SIBO tests and take functional stool tests and try and figure out what's wrong with you and take antibiotics, which may or may not work. Some people they do work for. So what I want to talk about is sulfur deficiency, your microbiome health, and how to improve your microbiome health naturally. So I've been doing this treatment for over 25 years, high-dose sulfur treatment. I've treated thousands of patients all around the world. Last count was about 8 different countries around the world. And I've started teaching other doctors and nutritionists how to use this protocol of high-dose sulfur powder so they can have an option to some of the more aggressive antibiotic treatments that are being used out there quite a bit right now for these symptoms. So I formulated a GI Janelle 1 powder in 2018. I wrote a book in 2019, and it covers all of this that I'm going to talk about. The book is called GI Janelle, Permanent IBS SIBO Resolution. And the reason that's important to me is that I get patients every day, every week coming to me who have been to so many practitioners and have been through so many treatments and so many different diets, and have taken so many antibiotics, and yet they're still not better. So I call it permanent resolution, because I plan to get you to a place where you don't have to think about your diet anymore. You can just eat the foods that you want to eat. You may have a couple of restrictions. Some people do, not everyone. But you don't have these constant annoying symptoms. So I will continue on with part 2, and we'll talk more about the parts of your digestive system.